Thank you, Ms Ryan, for your agile and dynamic chairing of this debate, and congratulations to the Honourable Member for Inverclyde for securing it. It's a vital issue we need to address in this House. The Glasgow Safer Drug Consumption Facility and Heroin-Assisted Treatment Pilot Project was initially advocated by the Labour Administration on Glasgow City Council. It was led by Councillor Matt Kerr, Convener of Social Work at the time, acting on a recommendation from the Glasgow City Alcohol and Drug Partnership that this was a worthwhile and highly evidenced method to improve the safety and hygiene of intravenous drug use in the city, and indeed it was supported cross-party and benefited from the wide support of, including the Honourable Member for Glasgow Central, who at the time was serving on Glasgow City Council. As many members may be aware, the issue of drug use and drug-related mortality in Glasgow is particularly acute, and it's a problem that necessitates radical and disruptive new approaches. Almost a third, 267, of all Scotland's drug deaths occurred within the Greater Glasgow and Clyde NHS Health Board area in 2016. Per million population, there are 283 drug-related deaths in Glasgow, but just 20 across the EU as an average. That means that Glasgow's drug death rate is an appalling 1,315% higher than the EU average and 329% higher than in England and Wales. Last year, 1,707 people died in the UK from a heroin overdose, yet no one has died from an overdose in a supervised drug consumption room anywhere in the world at any time. This is due to both the hygienic environment, medical supervision, and the readily available supply of life-saving overdose drugs like naloxone. According to the most recent estimates, around 13,600 people aged 15 to 64 in the Glasgow City Council area are problematic drug users. This represents 3% of the population, the highest prevalence rate out of all local authorities in Scotland, and significantly higher than the Scottish average of 1.75%. In my constituency of Glasgow North East, there are particularly high levels of drug use in Postle Park and Springburn, two of the most economically deprived areas of the constituency, following 8 long years of brutal austerity, which only serves to drive up levels of despair and alienation in these communities, which is one of the main reasons why people fall into the pernicious trap of hard drug addiction. These areas have also been plagued by the brutal organised crime war between rival factions seeking to control the supply of drugs in the city. Drug consumption rooms offer hope in this otherwise bleak landscape of despair. They are used as an effective public health measure in the Netherlands, Germany, Denmark, Spain, Norway, France, Luxembourg, Switzerland, Canada and Australia, with 90 facilities currently operating in 61 cities. It is clear that drug consumption rooms are a worthwhile and practical measure to introduce to Glasgow. They benefit society, for example, by reducing drug-related litter and needle stick injuries, reducing the spread of disease and making our streets safer, as well as having significant health benefits for those who use drugs. Drugs consumption rooms significantly reduce fatal overdoses and needle sharing that can lead to infections, including HIV and hepatitis, by providing people with sterile equipment. They've also been shown to increase the number of people entering treatment programmes. Use of a safe space provides the opportunity to start engaging people, to build up trusting relationships with appropriate professionals, which supports them to take those first steps to dealing with their addictions. The benefits of DCRs have already been demonstrated elsewhere, yet attempts to set up the UK's first DCR has been blocked. This is despite the idea being supported by the British Medical Association. This decision is typical of a government that takes little heed of scientific evidence of what works and what saves lives. This is primarily a question of public health, as has been said before, not one of criminal justice. I would therefore urge the government to adopt an open-minded approach, heed the consensus of all relevant parties and expert bodies in Glasgow, and reconsider amending the obsolete 1971 Misuse of Drugs Act to permit the piloting of the safe drug consumption facility in Glasgow in order to assess the opportunity it may bring to mitigate and solve the extensive harms we see caused by the current unregulated and unsafe drug consumption environment in my city.